My name is Julie Hurst, and I am the controller, and I work for Health South, and the building that I work in is the Rehabilitation Institute in St. Louis. I got the job, my very first job in healthcare because my stepmom was actually the CFO, and I happened to need a job, and I was working on getting my undergraduate degree, and they had a building clerk position open, so I took it and just kind of fell in love with the whole concept of working in a hospital, and then I kind of tried to figure out, okay, if I want to stay in healthcare, how do I keep going from here? And that was kind of how I said my career path was, where do I want to end up? And how am I going to get there based on the fact that I know I want to be in healthcare, and these are the things that I'm good at, which happen to be math. The primary focus, obviously, is going to be on making sure that we hit all of our required deadlines for any of the financial stuff that we have to do, whether that's approved accounts payable, finalized payroll, making sure that we submit our monthly and mid-month bills on time. But my primary functions are surrounded around doing the analysis work. So I come in and I look at where we are, and then I try to give the managers and the leaders of the hospital feedback on where they are up to date, what they can do to make sure that they stay in line with where they're supposed to be, and give guidance on the type of things that we should be doing today to help improve for tomorrow. The best part about my job is the fact that I get to work in healthcare and I see the outcomes that we are able to provide to our patients. And not being a nurse, a lot of times you don't get to see those types of things, but it's good to know that you're there, you're helping people, even if you're the one just making sure that the lights stay on by paying the bill, you're doing something to help somebody else. I would say that my advice for anyone working or trying to pursue a career in accounting or in healthcare finance is to truly look in your heart first, because it is a lot of work. There's a lot of things that go into it, and you have to truly be dedicated, but you have to also understand that you're not here for the mission of accounting, you're here for the mission of helping people. And so you always have to make sure that you put your priorities in check, even if your goals are financial based, and there has to be that structure there. In order to run a healthy hospital, you have to have strong finances, but you always have to look